Well, thank you so much, Carolina, for the introduction. And it's a pleasure to speak to you all today. I am talking about a review of resistance in US mosquitoes. So not just my own district, but taking a look at what we're seeing across the country. So looking at the US and looking at mosquito control here, there's two federal agencies that are in charge of a lot of the work that we're doing. The first being the United States Environmental Protection Agency. You'll hear me refer to them as the US EPA. They are the ones that regulate the pesticides and the repellents that are used by both professionals like mosquito control professionals that you're seeing speak today, but also private homeowners that are using repellents to protect themselves from bites. They work very closely with the Centers for Disease Control. We have a speaker later in today's program speaking from there. And the Centers for Disease Control, or the CDC, provides information on insect-borne diseases. And when there's outbreaks, they work very closely with both local and state agencies in order to disrupt those transmission cycles. These two agencies do work closely together, and then they do work closely with local and state groups. But you'll see that the information from one federal agency often references the information that's on a different federal agency. And so the work goes back and forth between the two. So if we look at the US EPA's website, knowing that they're often providing information for members of the public to know why are these mosquito control professionals doing things? What's going on? The US EPA references the diseases that the CDC lists, and the EPA says that the primary diseases in the US are Zika, West Nile virus, malaria, encephalitis, including Eastern equine, Japanese, and St. Louis, yellow fever, dengue fever, and chikungunya fever. And so these are the reasons that mosquito control professionals are making applications. When we look at these diseases and the viruses and pathogens, we can see that we're really looking at two genera of mosquitoes that most of the work is being done on. On the left is Aedes mosquitoes, Aedes aegypti and Aedes albopictus, the vectors that are transmitting the viruses that cause Zika, yellow fever, dengue, and chikungunya. On the right, Culex mosquitoes. Pictured here is Culex pipiens, Culex quinquefasciatus. Over on the far right is Culex tarsalis. These are our vectors of West Nile virus, Eastern equine, Japanese, and St. Louis encephalitis. And so the focus of this presentation is going to cover those two species, those two genera, ignoring the fact that there is work that is done for malaria mosquitoes, for the Anopheles, and for Eastern equine encephalitis, where Culecida plays a primary role in maintaining that transmission of that virus. So where are these mosquitoes in the US? Where can we find them? Well, the CDC has put out a map of probable ranges for Aedes aegypti and Aedes albopictus. This is from 2017. We can see that we're going to primarily find these mosquitoes here in the southeastern part of the US and over in parts of the western states. And again, albopictus is a little bit more cold tolerant, so it's going to be found more northerly than our Aedes aegypti mosquitoes. When we look for probable ranges of the Culex mosquitoes, I've stolen these images from a really fantastic paper that came out last year by Goris of the Suitability of Habitats for Culex mosquitoes in the Americas. So this is Culex tarsalis. We can see that it's found in a big part of the central parts of the US here with these darker colors. All the way almost to the eastern US, but mostly in the Midwest, and then really out here in California where I am and other parts of the western US. And then for the Culex pipiens mosquitoes, I'm lumping pipiens and quinquefasciatus together as part of this discussion. So for pipiens, we can see that we find them in the northwestern US, up here in Washington, and then up in the upper Midwestern states out to the eastern US. And more southerly, we find the Culex quinquefasciatus. So going along the bottom parts of the US, we find large pockets of Culex quinquefasciatus mosquitoes. So in doing a review of what kind of pesticide resistance we may have in an area, a really fantastic resource is the Arthropod pesticide resistance database. If you're looking for any kind of resistance to insects and the pesticides that are being used to control them, it is done in partnership with the Insecticide Resistance Action Committee. Registered users are able to make entries on cases of insecticide resistance for any particular insect, but anyone is able to search the database. And so when you go into search the database, what you can find is that you can put in the order of insects that you're interested in and the family. You can even go down to the genus and the active ingredient, the country, and look for where others have already done some of that work for you to find where there are resistance cases for a particular insect. It is a global database, and so you're able to get entries from anywhere in the world for any particular insect that you're interested in. And looking at the insects that I was interested in for this review, we can find that globally there are quite a few records of insecticide resistance for Aedes aegypti, nearly 600, and more than 250 for Aedes albopictus. I said I was grouping those Culex pipiens mosquitoes together. You can see that Culex quinquefasciatus had a large number, but there's other records for Culex pipiens, and then fewer for Culex tarsalis. There are records for Culex tritenorincus, not in the US. It is an important vector of the Japanese encephalitis virus, and so I wanted to highlight that for our colleagues that are following that outbreak. So looking at those records, these maps are going to be fairly similar across the next series of slides. I wanted to first highlight that there are lots of entries from work that was done for organochlorines, particularly DDT. And so in this case, what you're going to see is that a mosquito in a particular area means that there was a resistant population that was detected from that territory or that state if there's a box around that particular mosquito. So in this case, this brown box is for organochlorine resistance that was detected in Puerto Rico, Florida, and Texas for Aedes aegypti. When we then look at Culex tarsalis, we see that there was resistance detected in Utah, California, Oregon, and Washington, so our western states. And then for Culex quinquefasciatus pipiens complex, detections for the upper Midwest, upper Northeast, which is New York, Massachusetts, and New Jersey. Detections for both Puerto Rico and Georgia. And then back over to the West, we have Utah, California, and Hawaii. I show you DDT for a couple of reasons. Sometimes US Mosquito Control has said that we don't do resistance work, but this is a much older work that was done by George Giorgio in many cases. And secondly, we know that organochlorine resistance can be also cross-resistant to pyrethroids. And so we might see that this is an important thing as we're continuing to consider resistance in our mosquitoes today. Currently, by the US EPA, there are two classes of chemicals that are registered for control of adult mosquitoes by mosquito control professionals. On the left is the organophosphates, and on the right is the pyrethroids. For organophosphates, we're talking about chlorpyrifos, malathion, and temophos being some of the big players. For the right, I've included pyrethroids as the natural pyrethroids, which are not the synthetic pyrethroids. But we can see we have both type 1 and type 2 pyrethroids as part of this. There are limitations in the rest of the review that I'm about to show you. So not just using the Arthropod management database, I did search the published scientific literature for other instances and cases of insecticide resistance that were reported. This is very broad at a state level. And we know that resistance, as Nick so eloquently put out, is happening at a population basis, a much finer scale than what I'm showing you today. It does rely on the published information, and many of my colleagues on this call have been doing this kind of work. Unfortunately, sometimes it's not always published. As Nick also pointed out, sometimes we need funding and time to be able to do that kind of work. And so being able to have everything that is going on was a harder task, but I have relied on the published literature. And I also want to highlight that I'm relying on bottle bioassays and field data for this, rather than some of the genetic tests that Nick was pointing out before. I chose that because I wanted to see that there was the mechanism was actually being expressed, not just the genetic capabilities of that mechanism were there. So with those limitations in mind, I'm going to start with Aedes aegypti. We'll go through organophosphates and then pyrethroids next. So for organophosphates, there have been recorded resistant populations of mosquitoes in both Texas and in Puerto Rico, primarily to malathion, but also to temaphos. And for pyrethroids, we have seen detections of resistance to a whole suite of different pyrethroids in all of the instances that were found, which were Puerto Rico, Florida, Texas, and as well as New Mexico. So looking at those together and bringing forward that organochlorine, that DDT resistance that's in the more historic literature, what we can see is that there's a large concern for the mosquitoes that are Aedes aegypti in Puerto Rico and in Texas, where there's quite a bit of resistance, or at least a resistant population to all three of the different classes of pesticides that we've talked about, as well as there is concern in Florida for that resistance being developed and being passed on year. Looking then at Culex tarsalis in our Western US, we see that there were resistant populations to those organophosphates. Malathion is the primary one here, but also chlorpyrifos for Utah, California, Oregon, and Washington. And then some additional work for pyrethroids for Culex tarsalis in California, where there were resistant populations. You'll note that here in the upper Midwest in South Dakota, there is now a Culex tarsalis that's pictured here. There were susceptibility studies that were done there, and at least in that case, the Culex tarsalis were susceptible to permethrin. So bringing forward our malathion work combined with that older DDT work, we can see that there's concern in California that there's resistance to all three of those classes of pesticides. And again, resistance to two classes in Utah, Oregon, and Washington, knowing that our organochlorine resistance, that brown box, may mean that there is the opportunity for there to be resistance to those pyrethroids. Finally, moving to our more complex group, because there were a lot more work, as we are aware, Culex pipiens and Culex quinquefasciatus is the vector of West Nile virus, which has been found routinely in the US for the past 20 years. There is a lot more work that's been done on this mosquito, and that's increased quite a bit recently. But there is cause for concerns. There's work that shows that there's resistant populations in the Midwestern, all the way over to the Eastern US. So we've got Minnesota, Illinois, and Pennsylvania having resistant mosquitoes to malathion. We have in the Southeastern US from Georgia all the way over to Texas, resistant populations, primarily malathion, but also temaphos. And then in the Western US, we have resistance in Utah and California, primarily to malathion, but also chlorpyrifos. Moving forward to the pyrethroids, we see a similar pattern when it comes to our mid region of the country of Minnesota and Illinois and Pennsylvania, also seeing a suite of resistance to edafenprox, to permethrin, to pyrethrins. We see that we have resistance moved further up the coast in the southeastern and the central part of the southeastern, so upper to Tennessee and North Carolina and South Carolina, and including down where we were before, skipping over Georgia. We did find susceptible populations in the literature there, but also Utah and California having resistant populations to pyrethroids for Culex pipiens and Culex quinquefasciatus. So bringing forward our DDT results from earlier, most concerning here is these Western states where California and Utah are showing resistance populations to all three of those classes of chemicals, but also concerning are Minnesota, Illinois, and Pennsylvania, where both classes that can be used in the US are showing that there's resistance, as well as in the southeastern part of the US where we're seeing quite a bit of resistance. That's a lot of different information from a lot of different people. And so I went back to try to reclassify that in a way that maybe is a simpler take home for people about why this is so concerning. So looking at this again, What I've done is that you can see that the left facing mosquito, like this brown one that's here in South Dakota, is our Culex mosquitoes. And the blacker mosquito facing to the right is the Aedes mosquitoes. If there was a report of resistance to DDT, that organochlorine, I've shaded that box around it yellow. If there was resistance reported to one of the two current classes of pesticides that we can use for adult mosquito control, either the organophosphate or the pyrethroid, it's this oranger box. And if there was resistance reported to both of the classes that are currently available, organophosphate and pyrethroid, then it's this redder box. You'll see a few other notes that I'll highlight for you here. There has been some work that's been done on Aedes albopictus. So in a couple of cases, I'm highlighting that there's an albopictus population instead of Aedes aegypti. And CT over on these boxes is indicating that that's Culex tarsalis instead of the Culex pipiens quinquefasciatus complex. But the take home that you might expect from this is that there's a fair bit of orange and red on this map, things that are concerning for US mosquito control professionals. Particularly concerning is here in the southeastern US, where there is a lot of mosquito control activity that is done on a routine basis to protect those residents and visitors, but there are populations where there are resistance to one or both products that can be used in that particular area. Also concerning is in the western US, where we're seeing strong levels of resistance. And we're also concerned, of course, by what's going on in the territory of Puerto Rico and in the state of Hawaii, both areas that receive a lot of visitors on an annual basis. It feels a little bit doom and gloom to end a presentation like this, but I'll try to provide a little bit of sunshine to go with this. Resistance is clearly an issue in US mosquito control. And I know that my colleagues in the audience are probably saying, but it's not driven by us. I get that, but it's still something that we have to deal with. It's the consequence that's out there that is ours to have to work on and to try to make better. More information is needed. You see there's big holes in those maps, and I'm enlightened and encouraged by the work that the CDC has put into the centers of excellence that we have at partnerships of universities working with mosquito control professionals. And as Nick pointed out, funding is needed in order to continue to make this work successful. Resistance is also a finer population level problem than what is shown. So even if you're in one of those states where you saw red, it doesn't necessarily mean that your mosquito control products are not going to work. You do have to, as a local level, examine what's going on for those populations and to routinely take a look at that to see what's changing over time. I will highlight that I have a few selected references. If you'd like the full bibliography, my email will be on the next slide. I want to particularly highlight that those beautiful maps of the Culex mosquitoes came from the Goris publication. It's a really lovely piece that includes not just the US, but the rest of the Americas as well. I also want to highlight the work that Stephanie Richards at Eastern Carolina University did with her colleagues. It's a really fantastic study, and it added a lot of different pieces of information that hadn't been part of that Arthropod pesticide resistance database. With that, this is my email. I do have a picture of my colleagues from Indio, California. If you're in the Palm Springs, California area, please drive another 25 miles to the east. We'd love to say hi to you. Thank you so much.
Thank you, Jennifer, for such a comprehensive review. We do have 2 minutes. If anybody wants to share a question in 2 minutes, please raise your hand.
I do have one question that popped up in the Q&A for Jennifer. We can quickly touch. Says, thank you, Jennifer, for the review. Please, is monitoring in the US done all year round, or at what intervals?
Sure, it's a great question. What I was showing is work that's published, and so some agencies are doing it on an annual basis where they go through and check their population once a year. In some cases, it's the only report because it was a graduate student that was doing some work and maybe collected mosquitoes for a couple of years and then didn't do any additional work because there just isn't the funding for that. So it's really varied, and it's really inconsistent, and it would be great to have additional funding to make that a more consistent annual basis that everybody can do.